Hello, everyone. My name is Katie, and I'm a master's student at Ohio State studying mechanical engineering. And today I'm going to talk a little bit about bone imaging, modeling, and surgical tool design. Everyone has bones that are all different shapes and sizes. And when surgeons perform surgery on them, they have to account for all the different shapes and sizes of bones. They often use freehand techniques where they're not using a lot to guide them when they're doing the surgery. Today I'm going to talk a little bit about tools that surgeons can use to help them account for all the different patient anatomies that they have to handle during a surgical procedure. Has anybody ever had a CT scan before? If you have, you might be familiar with this machine here on the left. This is a CT scan machine. A CT scan is a medical imaging technique that's used to obtain detailed images of the body to help diagnose disease or injury and plan patient treatment. On the right here, you'll see three different examples of a CT scan images. This is a human knee. This one here on the bottom left is a human torso, and this is a human head. One way to think about a CT scan image is like a stack of Post-it notes. So if you've ever seen these spiral stack of Post-it notes before, the individual Post-it notes stack up to make that 3D shape. And that's very similar to how a CT scan works. You have the CT scan, which generates many different images that are essentially slices of whatever it's taking a picture of. And you can then use software like 3D Slicer to take all of these individual image slices and put them together to create a 3D model. This animation on the right here, you can kind of see how as I pan down through the 3D model, the image slice that corresponds to that point in the model changes. And these 3D reconstructed models can be used to help diagnose disease and injury or plan patient treatment, as I mentioned before, but they can also be used in engineering design, and that's what I'm going to talk a little bit more about. So what are patient-specific surgical tools? These are tools that are made specific for a person's bone and can help guide surgeons when they're performing surgical procedures. So this is kind of how I mentioned before, the types of tools that surgeons can use to account for all the different shapes and sizes of people's bones. There's three different examples on this slide here. Some benefits of this type of tool is that it increases the accuracy of the surgery, leading to better outcomes, better surgical procedures. It also reduces the amount of time it takes a surgeon to perform a surgical procedure. And the models that are created from CT scans are used in the design of these tools. And I'm going to talk a little bit more about that. So how can these tools be made? One way that they're made is through 3D modeling programs called CAD programs. CAD stands for computer aided design. One type of CAD program is SolidWorks. And that's how the images you see here were generated through SolidWorks. So on the left here, you'll see the 3D model of the bone that was created using the CT scan images, then transformed into what we call a mesh model, which is essentially several different triangles put together to create the reconstruction of the bone. And from this model, you can then design the surgical tool around the bone, which you see in the middle here. You can see it fitting flush up against that bone model. And on the right here, you can see how the surface of the cutting guide or the surgical tool corresponds to the shape of the bone. And that's how the surgeons fit it up against it to help them in the procedures. So how can these be manufactured? One way that these types of tools can be manufactured is through 3D printing. If you're not familiar with 3D printing, it's essentially like squeezing a tube of toothpaste. A nozzle heats up the plastic and it then moves around to create different shapes out of the melted plastic, and it then hardens to create a solid tool. So in this image, you can see a final product of a surgical tool. On the left here, you can see it 3D printed. And on the right here, you can see it in an X-ray image as it was used in a surgical procedure. So to summarize, you can take CT scans and turn them into tools that can help surgeons account for different shapes and sizes of people's bones in surgical procedures, starting off with the CT scan images that stack up to make the complete 3D model. Then you can use CAD programs like SolidWorks to create the surgical tool in a computer program. And after that, you can use 3D printing to manufacture it and ultimately end up using it in a surgical procedure. Thank you for listening, and go Bucks.